Hi, I'm Clarissa Mosley, psychologist and psychotherapist, and I wanted to have a chat today about ACEs. ACEs are not, as they sound, advantageous life opportunities or luck. ACEs are actually adverse childhood experiences, and the study that was conducted decades ago on, I think it was about 17,000 people over a long period of time. So starting in childhood and working through to adulthood, they studied these people and they worked out a questionnaire that asked about 9 different questions about adverse experiences that happened in the person's childhood. These are things around feeling abused, physically, emotionally, psychologically and sexually, around addiction and alcoholism within the family. Did a family member ever go to prison? Were your parents divorced? And these kind of experiences that many children endure that can have what they found to be a lifelong effect on their health. So what they found out was the proportion of ACEs, so on a scale of 1 to 9, led to statistically significant correlation, meaning there was basically a cause, although we can't actually say that in science, but there was actually such a strong relationship between how many adverse experiences a person had in their childhood and their chances of developing obesity, diabetes, heart disease, addictions, and dying young, to name just a few. And this is one of the reasons why I emphasize the strong connection between your psychology and your physiology, your health and well-being. And it's a chicken and the egg thing, really. The thing with childhood experiences, if we look at Gabor Mate's definition of trauma, it is not the actual event that is traumatic, it is the experience or how the person experiences it. And this can have a lot to do with their level of sensitivity, but also we've got to understand that all children are pretty sensitive to what's going on and who's doing it. And if it's their caregivers that are the source of abuse and fear, this is a massive problem for a child because there is nowhere safe for them. This means that their body is their physiology, they are constantly in a state of fight or fright or freeze because the parents are meant to be the ones that the child goes to for comfort and care and safety and to feel loved and secure. If that parent is the source of physical, psychological, emotional or sexual abuse, then the child is frozen because they want to run away, but they can't run away from the parent, that's their parent. The nervous system is in the state of high alert all the time. They don't learn well at school, certain brain systems don't develop properly, certain neurochemical pathways don't develop properly. They have a lot of cortisol and adrenaline. This causes a huge amount of problems within the system. It degrades many systems. It causes changes at the cellular level, particularly the mitochondria, which is where all the energy is produced and a lot of the DNA synthesis happens. And so what happens then through epigenetics is that the stress causes certain genes to switch on and other ones to switch off. Now the genes that switch on might be the genes that are related to inflammation, and we know what a problem inflammation is. And the genes that switch off might be the ones that are related to reducing inflammation, and this is just one level. The immune system can get chronically overactive, and this can happen through the HPA axis, the hypothalamic, pituitary and adrenal axis. And I'm not actually going to go too deep into those health things because I'm not a doctor and I probably wouldn't give them justice. But I've given you a broad sort of few names and words that you could maybe look up with caution, and of course the trigger warning is that it can be pretty overwhelming. But the good news is that you can realize that your psychology now might not necessarily be your fault, if that's any consolation. A lot of these things were put into motion early in your childhood. Of course, you can take some authority for trying to mitigate the effects of the adverse childhood trauma that you experienced at the hands of the ace holes in your life. But, you know, the health effects are ongoing. And so I've been doing a little bit of research recently into that aspect of the mitochondria. Now, we know about them maybe from school, the powerhouse of the cell. And what we'll find is that people that have gone through long periods of stress in their adult life can end up with this chronic fatigue or can end up with burnout. And what I often find is that these are people that have undergone a lot of stress in their childhood. It's almost as if their system just can't do it anymore. And so everything was already on a sort of a teeter-totter scale, and then all of this long period of stress, often through work and the unreasonable demands that so many workplaces put on humans, that they end up just being literally burnt out. And they're kind of like, I don't understand why I suddenly have zero energy when I've been running on adrenaline for this long. And it's, well, unfortunately, you've just worn everything out and your mitochondria have probably gone into what's called cell danger response. And they kind of shut down and isolate themselves off, and they become impermeable to letting anything across the cell membrane. And this is, again, another whole science medical topic, which I probably won't do justice. But these are the underlying factors. They're actually happening in your body at the level of your biochemistry and your cellular health. So it might be interesting at this point to actually look at the actual questions within the ACEs questionnaire so you can get a gauge of exactly what they are. So I'm going to take you through them. You can get a pen to mark down yes or no, and be aware that they're very yes or no answer questions. So you might have an experience of something that is unaccounted for in the questionnaire, or you might have nothing on the questionnaire yet still have suffered in some way that wasn't quite enough to even, you know, make into a question. Okay, are you ready? Question number 1. Did you feel that you didn't have enough to eat, had to wear dirty clothes, or had no one to protect or take care of you? That is a tick box for neglect. Question number 2. Did you live with anyone who was depressed, mentally ill, or who attempted suicide? So there's a checkbox for growing up with a parent or living in a family environment where there was someone with a significant mental illness. Question 3. Did you lose a parent through divorce, abandonment, death, or another reason? And so there you would be left in a single parent family and often feeling quite abandoned and grief and loss if that parent had died. Number 4, did you live with anyone who had a problem with drinking, using drugs, including prescription drugs? So obviously that's a screening question for someone in the household that had a drug addiction. And the mentioned prescription drugs I think is relevant because of the huge misuse of painkillers that we've seen in America and also happens in many other countries. Number 5, did your parents or adults in your home ever hit, punch, beat, or threaten to harm each other? So that's witnessing parental violence. Number 6, did you live with anyone who went to jail or prison? Did a parent or adult in your home ever swear at you, insult you, or put you down? So this is psychological emotional abuse. Did a parent or adult in your home ever hit, beat, kick, or physically hurt you in any way? And this is physical abuse towards children. Number 9, did you feel that no one in your family loved you or thought you were special? And number 10, I'm sorry, I said there were 9 questions, there's actually 10. Number 10, did you experience unwanted sexual contact, such as fondling, and in some questionnaires they say by a person who was over 5 years older than you. And so that is a score that you can have out of 10. And then there's a final one. Do you believe that these experiences have affected your health? Now, the thing about the ACEs questionnaire is that it can tell us a lot about someone's potential health outcomes and their need to pay attention to that. But they're not the whole picture. And I've certainly found in my own clinical practice that I can have, because I do actually I use the questionnaire sometimes, that I can actually have two people, and one of them, for example, they might be in a couple, one of them might have a really high ACEs score on that metric, but how they experienced everything is not quite as extreme as another person. Maybe their partner has only got maybe a score of 2 or 3, but what became of those experiences was far worse. So say there was one person and there was abuse, the parents stayed together, and so despite the arguing, there was a stability, and that particular person didn't have to move around too much and didn't have to move between houses and didn't have to undergo the associated poverty that can happen after divorce. Whereas the other partner had not so many tick boxes on the questionnaire, but their experience of their divorced parents was that they were left abandoned by one parent, and their life with the remaining parent was an absolute desert. There was just nothing after that. And that's a far more profound experience, resting on someone who has maybe a more delicate nervous system or a higher level of sensitivity, simply temperamentally, than the other person who might have a higher score. We do know that these experiences can have a huge flow-on effect to someone's health and physical well-being for many of the reasons that I described earlier in this video. So that's a brief overview of the ACEs, the Adverse Childhood Experiences Study. I hope you enjoyed this video. If you did, hit the like button, and if you want to hear more from me, feel free to subscribe. Thank you.